Hi, I'm Dr. Lyle Stephenson, and I'm going to be covering some questions we're getting daily about COVID and your child in schools. So if you receive a call, like most of us, that someone at your child's school has been diagnosed with COVID or tested positive for COVID-19, you really don't have to do anything. Essentially, you wait to see if you get a second call saying that your child has been directly exposed. There's no reason to go out and get tested, to get checked, or anything like that, just on the first call that we seem to be getting just about every day. If you're informed that your child was directly exposed, you'll need to have your child quarantined. There are two options for quarantine, either a shortened quarantine where the child can quarantine for 7 days if a negative test is taken at day 5 or later, or 10 days with no test administered. If you're exposed and your child was not exposed at the same time, you should do reasonable quarantine. Not be in direct contact with your child just in case you contract it. But again, that's within reason. Your child doesn't need to take a test immediately if you're exposed and they were not. If you or another adult in your household contract COVID, then we have to do a little bit extra. First, as always, we need to quarantine as well as we can. If there's another family member the child can stay with, things like that, that would be great. But again, we have to quarantine, okay? So your children will need to do at least the quarantine you do plus their own quarantine. If you test positive, your quarantine is 10 days, and then the child's quarantine is at least 7, again with a negative test at day 5, or 10 if you choose not to test. I know that seems like a long time, but your quarantine has to be up before the child's quarantine begins. Childhood symptoms of COVID are just like any other virus. We see a lot of kids with fever, headache, sore throat, malaise, general tired feeling, and just general viral symptoms. Essentially that they feel really bad. We have seen some kids with stomach pain, diarrhea, but those are a little bit more rare. If your child has developed severe symptoms like cough, shortness of breath, they should definitely be immediately seen. So if there's a reasonable suspicion that your child has COVID, essentially you've had COVID in the house and they begin to develop mild symptoms, you don't necessarily have to have them tested if you're comfortable with managing the symptoms at home. Now, if you're uncomfortable, we're definitely available to evaluate your child and see if they need testing. But again, not everyone needs testing for this because for a lot of people, we're just getting mild viral type symptoms. So if your child develops severe symptoms, high fevers, really lethargic, severe cough, shortness of breath, things like that, you should definitely be evaluated by a physician. Now, we can't tell you exactly when that point is for everybody because a lot of times parents are worried. So we're happy to check out any child that needs to be evaluated, and then we can decide if testing is warranted or further treatment for those symptoms is warranted. So if your child tests positive, there's no definitive treatment for COVID, especially in children and especially in those who are fine staying outside of the hospital. And that's the way we want to keep most kids, is out of the hospital. If your child is positive, they'll need to quarantine at least 10 days from the onset of symptoms. They do not need a negative test to return to school because we know that some people will remain positive for 5-6 weeks at a time. There aren't any specific treatments for COVID-19 in children. We use Tylenol and Motrin to treat fever. Both of those are safe, both of those are effective. We want to keep your child hydrated just in case they don't want to eat as well, don't want to drink as well. We treat symptoms like cough with cough and cold medicines, and symptoms like wheezing with medicines for wheezing like breathing treatments. If necessary, if your child has to be hospitalized or things like that, there are treatments like the monoclonal antibody infusions, IV fluids, breathing treatments, and other respiratory therapies. But hopefully, for most kids, we don't need to get there and can treat it at home like you would any other virus.